How to tell if a cat is injured after a fall. Cats are known for their agility and the ability to land on their feet, thanks to their unique righting reflex. However, this doesn't mean they are immune to injuries from falls. Whether your cat has fallen from a high place like a window, balcony, or tree, it's essential to assess them for possible injuries. Even if they appear fine at first, internal injuries may take time to show symptoms. Here's how you can determine if your cat is injured after a fall and what to do next. Immediate signs of injury. After a fall, observe your cat's behavior and body language closely. Some injuries are immediately noticeable, while others may take time to appear. 1. Difficulty breathing. If your cat is breathing rapidly, wheezing, or gasping for air, it may have suffered chest trauma or lung injuries. Check for open mouth breathing, which is a sign of distress. 2. Limping or not walking normally. A cat that is limping, avoiding putting weight on a leg, or walking stiffly may have a fracture, sprain, or joint injury. If they refuse to move at all, there may be a spinal injury. 3. Visible bleeding or open wounds. Check your cat's body for cuts, scratches, or bruising, especially around the mouth, nose, and paws. Internal bleeding may not be visible immediately but could cause pale gums, weakness, or collapse. 4. Swollen abdomen or tenderness. A bloated or painful belly could indicate internal bleeding or organ damage. If your cat reacts strongly to being touched in the stomach area, see a vet immediately. 5. Head trauma signs. Look for signs of concussion or brain injury, such as disorientation or uncoordinated movement, seizures or sudden collapse, uneven pupil size or excessive drooling. Head trauma can be life-threatening and requires urgent medical attention. Behavioral changes after a fall. Sometimes, an injured cat may not show immediate physical signs but will behave differently. Look for these changes: heavy checkmark hiding or avoiding contact. Cats often hide when they are in pain. If your cat is staying in a corner or under furniture, they may be hurt. Heavy checkmark excessive meowing or growling, vocalizing more than usual or reacting aggressively when touched can indicate pain. Heavy checkmark lack of appetite. If your cat refuses to eat or drink, it could be a sign of trauma or internal injury. Heavy checkmark lethargy or weakness. If your cat is unusually still, sleeping more than usual, or unable to jump, they may be suffering from a serious injury. Heavy checkmark shaking or trembling. This can be a response to shock, pain, or internal damage. What to do if you suspect an injury? If your cat exhibits any of the above signs, follow these steps. Heavy checkmark limit movement. If you suspect a broken bone or spinal injury, avoid unnecessary movement. Place your cat in a comfortable position and prevent them from jumping or walking too much. Heavy checkmark check for breathing issues. If your cat is struggling to breathe, seek immediate veterinary help. Heavy checkmark apply pressure to stop bleeding. If there are cuts or wounds, use a clean cloth to apply gentle pressure. Heavy checkmark use a carrier for safe transport. When taking your cat to the vet, use a sturdy carrier with a soft blanket for support. Heavy checkmark visit the vet immediately. Even if your cat seems fine, internal injuries can develop hours or days later. A veterinarian can perform X-rays and other tests to ensure there are no hidden complications. Preventing falls in the future. To reduce the risk of falls, consider these safety measures. Heavy checkmark install window screens and balcony guards. Many falls happen due to unsecured windows or railings. Make sure your home is cat-proofed. Heavy checkmark provides safe climbing spaces. Cats love to climb, so offer cat trees or shelves that allow them to explore safely. Heavy checkmark supervise outdoor time. If your cat goes outside, keep an eye on them to prevent falls from trees, fences, or high surfaces. Final thoughts. While cats have a natural ability to land on their feet, falls can still cause serious injuries. The key is to observe your cat carefully after a fall and look for any signs of distress or pain. If you notice breathing issues, limping, bleeding, or behavioral changes, seek veterinary care immediately. Acting quickly can make a significant difference in your cat's recovery and overall health.